Yes. We're very pleased to be joined by Richard Staynings, Chief Security Strategist at Cylera. We're joined by Mike Archuleta, CIO at the Mount San Rafael Hospital, by Howard Haile, CISO at the SCL Health, Kevin Coston, Senior Technical Security Specialist, Healthcare Modern Workplace at Microsoft, Randall Frietzsche, Enterprise Chief Information Security Officer at Denver Health. It's a pleasure to have you all on. I'm going to leave you in the capable hands of Richard Staynings.
Thank you very much, Philemon. What a great local Colorado, cast here today of healthcare security leaders. So thanks, guys, for taking time out of your busy days. And Kevin, I think you have the longest title I've ever seen on one of these shows. But congratulations on the new job since we last met. I know you've been there.
Even to Microsoft.
Yeah, exactly. Cool. Well, thank you, everyone, again. So let's start, panelists, by talking about, the age-old problem of security resources, right? Attracting and retaining top security talent, particularly in healthcare, where we don't pay as well as, the banks and the JP Morgan Chases, shall we say, of the world. It's a very competitive market. It's difficult to attract people. It's difficult to retain people. It's a challenge to train. And I know Fritz and I are both involved in academia in training a lot of the next generation of security leaders here. But how do we deal with the shortage of qualified, certified, or experienced cyber professionals? Mike, you're the CIO of a fairly significant and growing health system down in Trinidad. How do you manage to find staff, particularly in a small place like Trinidad, where you don't have the market, should we say, of the Boulder Denver corridor?
No, absolutely, Richard. And I think, when we've seen what has really happened to the healthcare industry itself, I mean, the acceleration of digital transformation, it's been one of those huge booms. It's like the chief digital officer didn't bring change, chief information officer didn't bring change, COVID-19 brought change. And when we look at this as a whole, we've seen just the mass drive towards telehealth initiatives, towards remote working. And now this has brought a lot of opportunities for our organizations to reach out to more of the workforce remotely. We don't have to actually, have a physical individual here anymore, because we can now obtain talent from anywhere, actually anywhere around the world now. And you could really work from any place. And I think that's what one pro that this overall pandemic has brought, has really just broadened the aspects of different talent. Because honestly, as you stated, it is almost impossible to bring strong, good talent here to our overall community itself. Yes, our community is growing. I mean, we're becoming a really artsy place. A lot of people from Denver are actually moving down this way. But again, it's really looking at those remote services and looking at some of those strong managed services to really create those remote opportunities, which has been pretty successful for our organization.
Cool. Thanks, Mike. Howard, how are you handling things up at SCL?
Well, I tell you, Mike did a great job of explaining that, because as he stated, we always talked about remote work, but it always seemed to be in the future, and it arrived very suddenly. We went from 5,000 people in our system office to pushing everybody out within 2 weeks. So we had to get very good at that very quickly. And honestly, it was a managed service approach that really was able to get us to that point. So we had been looking at managed services around multiple areas of our team, for the reason that you're stating, is that we did and we continue to have issues finding, attracting, and keeping qualified talent. And so that for us was really an eye-opener. So for me, moving to a managed service model in some key areas is really what bridged the gap for us very quickly when COVID hit.
Cool. So Fritz, does that hybrid virtual model work for you at Denver Health? I mean, you're probably subject to slightly different conditions than Mike and Howard are here, given Denver Health. How does that play out in your sphere?
Well, before the pandemic, we obviously were very limited in geographical area in terms of who we could reach out to and hire, unless we wanted to relocate them to Denver. And now, obviously, the door has been open to allow us to recruit other folks in other states. which could be good. However, we have to change from an administrative level, legal, HR, in order to figure out what states can we hire in and have a resident of that state working for our business. And it's extremely complex, just all the issues from filing a business with the Secretary of State, the HR laws. You have to have different offer letters, sometimes not only the state, but at the city level or the county level. So many complex HR administrative and legal issues that we have to entertain before we can actually take advantage of the possibility of hiring someone out of state. But I would say one thing that we could do is be more flexible when we hire. We always hear about all the horror stories of, I want to be a junior cybersecurity analyst, and they want 5 years and a master's degree or something crazy. And just these arbitrary, inflexible HR rules around what requirements we need. And that really causes us problems when we're trying to hire people. And the other thing I think is, as leaders, we can be participants in the process of really educating and evolving academia to come around to the modern world where you have to have some background. And so for like a cybersecurity program, you want to have some really good networking. You want to have some foundational IT courses across the board if you really want to release this person into the real world and have them find a job and excel in that job. So I think it's incumbent on us as leaders to really help and get involved in academia from that perspective.
Yeah, and I think you and I, Fritz, have both written about the skills inflation requirements coming out of HR for some of these positions, and just how crazy it is, right? We need warm bodies in seats with the right attitude more than a string of certifications and qualifications at this point. So the odds are stacked against us. So okay, I'm going to throw things over now to Kevin. Obviously, Kevin, you're with Microsoft. You're a big vendor. You're helping a lot of healthcare companies right the way across the world, in fact, right? And Microsoft is quite feasibly entirely virtual or nearly virtual, right? From what I've been reading. How are you handling this? The change in circumstance and the need to provide the types of managed security services to folks like Fritz and Mike and Howard.
Well, it's its own problem. You guys have stated a lot of the things, the skills, talent, the bodies and seats, the processes. But the first thing I want to go to is address the first question, the virtual environment. We saw a significant uptick in use in M365, O365, Windows 365 for the fact that many of our customers were adapting an hybrid modern work approach. So all of a sudden overnight, demand created change. COVID hit, the Great Resignation hit at the same time, and it created a perfect storm of not only needing bodies and seats, but simplicity. So what we see a lot as far as our virtual desktop solutions, our virtual platform solutions, our customers are trying to stand things up quick with simplicity. And when it comes to the security side of things, they don't want to have to figure out how to use these tools. They want to be able to implement them as fast as possible. So things like partner solutions and bringing in an MSS that can actually, implement and use the solution simply so that they can get at least to a moderate level of maturity with their security program. I think what I'm seeing a lot of in the vendor space specifically related to that are a lot of our customers are trying to move to something like a virtual desktop, but now they're having the problem of, okay, what are they accessing it from? Is it a compliant device? Are they going to be accessing it from a network that, they have other devices on? This is BYOD. So then this starts to complicate things even more, so I think that's one of the things we're seeing a lot of is the migration to the cloud environment, but, also the challenges of inventorying what you already have and, applying what you can still use along with your budget. We have systems on the call, so I know that's very familiar with you guys is, okay, what do we currently have? What can we use? And what do we need to, tackle the use cases that we have right now? So that's a lot of what we're seeing at Microsoft is just the can you help us, right? We've started on this journey. We have some things in place. We understand that we're trying to get to a zero trust network architecture because we're in a hybrid world now, but we need your help, because we're short staffed. We talked about the staffing problem with with everything from entry level up to senior level, right? I mean, I think this is a broad gap that we have.
I'm glad you brought up the question of simplicity, because, you know, at the same time, the healthcare environment, and I've been working in healthcare for 30 odd years, like some of the folks on this call too, you know, it has evolved, right? We now have massive levels of digitalization, interoperability, digital transformation, a proliferation of healthcare IoT, right? Medical devices that now make up 3/4 of the IP connected assets on our networks, right? A whole load of unmanaged assets. We've got consultants coming in and providing services to patients with their own laptops. We've got guests that are attaching to our networks and doing God knows what on the SSID that we've made available to them. How do we deal with this, right? Howard, how are you managing things at SCL with you know, this constant change in technology?
Yeah, it's a great question, and I'd say, you know, we're learning as we go. You know, I think the call out around medical devices is an important one. It's been well documented that, you know, before medical devices were not network connected, and then at some point everybody's like, well, we need to connect these to the electronic health record, so let's slap a NIC in it and let's connect everything. But there's really no understanding of security around medical devices. You know, thankfully there's been some technologies, you know, that have evolved over the past few years, if nothing else, to be able to give us visibility and understand risk. And that's another area, you know, to be able to scale that program and be able to hire and find qualified people that know the medical device side as well as the security side. That's a heavy ask. So we actually, I just recently, over the past 6 months, moved that program out to a managed service force as well, to be able to, you know, to be able to bring in that expertise and manage that risk quickly. But the amount of variation of technologies across the board when it comes to patient care is something that's very difficult, and everybody wants to either integrate with the health record, they want to move it to the cloud, they want to be able to all do all of these different you know, different patient care, and it's all great ideas, but it's extremely hard to try to bring this all together and make it efficient on the back end, and then you know, also secure it. And I think it's an evolving area, in my opinion, is how do we continue to have this variation? And hopefully, at least from an SCL perspective, we are working very hard on rationalizing all of our applications and systems, moving everything we can to specific trusted vendors, and then looking at how we can expand services with them instead of doing best of breed approaches.
Cool. Thank you for that, Mike. I know you've just gone through some massive construction work down at down in Trinidad. You doubled the size of your hospital. You've changed out a lot of your IT. How are you managing with the levels of digital transformation and change in a relatively small hospital system?
You know, Richard, that's a great question. You know, as Howard was basically stating, you know, we definitely continue to learn with the overall process that we're basically doing. But see, the thing is what, you know, we've seen the acceleration of digital transformation truly happen, you know, within this actual industry itself. But we continue to still have that overall brick and mortar theology in healthcare. And the thing is if we do not basically change some of the cultural initiatives and incorporate security and IT as a core component to the overall organizational strategy, how do you expect for us to be successful moving forward and continue to invest in cybersecurity expertise, to invest in new cybersecurity projects, to continue to accelerate digital transformation? That overall theology needs to go away. And we still have so many antiquated systems in this industry itself that honestly, we should have been the leaders and the pioneers of moving to the cloud first and foremost. We should have been the leaders and the pioneers of truly accelerating digital transformation, because what are we doing? We are doing the most important thing, and that is taking care of people's lives, saving lives moving forward. And the problem is, though, is that a lot of organizations don't really incorporate IT and cybersecurity because they've always seen this as a cost center. Okay, IT, cybersecurity, they cost too much. Well, ladies and gentlemen, security and IT can no longer be considered a cost center, but a strategic revenue contributor that drives strong innovation and better initiatives for the organizations. Because when I always try to sell an overall cybersecurity project moving forward to the board of directors, I focus on FOR, which I look at what would happen on a financial standpoint if a breach happened, what would happen on an operational standpoint if a breach happened, what would happen on a reputational standpoint if a breach happened. These specific cultural initiatives need to be changed in order for us to say, hey, let's invest in more remote workers, more expertise that are basically needed in this industry itself. And if you look at some of the numbers, 83% of healthcare systems are still running on outdated software. This is a major problem, ladies and gentlemen. And we continue to see this industry going from what, the top 10 to now the top 7th most attack sector out there. You know, we need a strong cultural change in this industry. And the thing is too, is if we want to partner up with, I don't like calling them vendors, I like calling them business partners. We have to select proper business partners, because at the end of the day, their success is our success and our success is their success. And that's how we should basically be driving some of these managed service providers.
Yeah. And yet, you know, the industry as a whole is still demanding that patients go in and wait around for half an hour to see a doctor, right? You know, despite the telehealth burst that happened around COVID, where no one wanted to go anywhere near a hospital or a doctor's office, we've kind of reverted back to our old ways in many ways, right? And I think it's the physicians that are driving that, because, you know, and the payment models, of course, that are helping to contribute to that, rather than driving us forward. But you raised one very interesting point, Mike, and I want to hand this over to Fritz to talk about risk, right? How do we manage this, you know, as this technology as it expands, as the vendor mix, you know, the partnership mixes, as you describe them, expand? How do we manage this proliferation of third parties and the risks that they present to the healthcare delivery ecosystem?
Yeah, that's an excellent question. So we see, and I'm sure most other organizations, especially in healthcare, see almost every technology solution that we purchase, whether that's a cybersecurity or IT or a business or clinical application, they're almost 100% SaaS type of solutions. And so we are trusting someone else with all of our data, and we have to assess the risk. What are their controls? What are the gaps? What could the risks be from those control gaps? And I find a big problem in the folks that work in IT security. They're not experts in cloud. And so to be able to risk assess someone else's cloud, there's so many different ways you could put together a cloud, SaaS, different vendors, you know, containers versus infrastructure as a service. And, you know, how many IT security analysts doing risk assessments understand the cloud at the level needed to really be able to vet that vendor in the way they've built that solution to the point where we can assess it for risk against our organization, our data. And so I think that's a big problem. And so I've often thought, we still do that in-house, but I've often thought about having an MSSP doing those pre-contracting third-party risk assessments, especially when they're cloud, and make sure that vendor, that MSSP, has deep expertise in all forms of cloud so that we can get a really qualified risk assessment done on those vendors. And I just think that unless you really educate your people and have them trained up to that level, you know, you may have to go with an MSSP if you're really seriously concerned about cloud risk assessments.
Yeah, that's a really good point, Fritz. And it's not one that we've kind of brought up in these MSS forums before, but I think there may be an opportunity there for everyone who's tuned in from the managed security services space, you know, maybe to address this. You know, if Fritz is having problems, then I'm sure most other organizations are too. But is there really, should the onus be on the providers of healthcare services to either acquire those services to do that, or to build those skills internally in order to risk assess a massive proliferation of vendors? I mean, I did some work at a pediatric hospital a couple of years ago, and we discovered thousands of additional vendors in their space that they had no idea about because their procurement systems weren't centralized, their third-party risk management systems weren't centralized, their legal systems weren't centralized, and it became a nightmare. Should we require all of our vendors to, to have attestations to, SSA 16, SSA 18, SOC 2, for example, based upon the control sets that, are important to us? Should we require, ISO 27001 for other types of vendors? What are your thoughts, Fritz?
Well, so let's talk about SolarWinds. So let's just say that we had the most expertise in the world, and we were going to buy SolarWinds to work on our network, and we risk assessed SolarWinds, and we couldn't find any problem with them. And we brought them in, and then they had been hacked, and we know the story of SolarWinds. So I'm like, what level risk assessment would have found that before we bought them? And the fact is, SolarWinds didn't even know about it. And I'm sure they do a very good job with DevSec. And so how do we actually know? And I think the answer is we will never really know. We just have to do the best we can. Sorry, go ahead.
Fritz, I'm sorry to cut in, but I'm going to give a more recent example, which is Kronos. We've been part of the Kronos, unfortunately, from a timekeeping and nursing scheduling standpoint. And I can tell you, we did an assessment on them, and their SOC 2 report was clean and everything. In fact, their documentation was beautiful. I mean, they had everything, and yet they still were hit. And so, to your point, Fritz, it's like we can do all that, but there's still just areas that we're not going to be able to know. And unfortunately, we have to move to our disaster recovery and business continuity plans, and we've been working in a downtime state now since December 11th on that. So I don't know if there's a good answer to that one, because I can tell you that from that standpoint, it was perfect documentation, third-party attestation, and yet they still got hit. And so I've wondered that same question myself, is what else could we have done? And I'm not sure what we could have done.
Right.
Yeah, I agree with that. That's that's the answer. I think we will never know everything. And I think it's where we really call it due diligence, right? It's the diligence we can do, the best of our effort, and then we have to have some compensating controls in place. So if by chance they are breached, when we stick them on our network, that we have some controls in place that specifically look at these and say, well, if this thing is breached, what do we need to prevent that from actually becoming a problem for us?
Right. I was going to chime in there and talk about Hafnium, but instead I'm just going to hand it over to Kevin to ask what Microsoft's recommendations are around what healthcare providers should be looking for. How should they manage their third-party vendor risk?
I thought that was an interesting conversation, and I was actually going to chime in just due to the fact that we deal with this on a daily basis. So one of the things I want to say is nobody's impervious to a breach, not even the smartest of the smart, not even nations that, have nation state assets. I mean, we've seen this over and over again. So I completely agree with you guys about due diligence and proactivity. I think one of the areas that we also have to look at is reputation and the number of assets that they have available to remediate if something does go wrong. So, that is a compensating control as far as the people and the processes that they have in place, along with the technology if something goes wrong. So that's one of the areas that I would first look at is, okay, well, first off, proactively, what are our biggest risks, our P1, our P2, our P3? How are we going to protect that? Then we start to look at our vendors and say, okay, we need to vet these guys really well. We need to stay in constant communication, because I do feel like the onus is on both. As Michael said earlier, we're partners. We're not a vendor and a customer. So, our due diligence is to provide you with attestation statements, let you know what compliance and governance that we fall with under, that, that we have covered, and try to find out, what the business use cases that you guys need covered, as well as the governance and compliance that you may fall within. And then we start to work together. But if something does happen, we need to communicate that, and we need to communicate that swiftly within the ecosystem so that everybody else knows. Because like I said, we see this over and over again. And I think that, one of the biggest aspects of this is you put a security vendor out there and expect perfection, but you also have to remember that they are still a technology stack, and that they're still, not impervious to a breach.
So this probably makes a very good case for a layered security approach, right? So you've got
Absolutely
layers of security, so that when one is breached by whatever means, and it's inevitable, I think, today, that you've got other controls or other compensating controls that you can leverage in order to keep your data safe. And in our case, our patients safe, right? And our patients not introduced to safety risks. Well, I think we've got about 3 or 4 minutes left. I want to do a final round here. Start with you, Mike, on the role for specialist healthcare managed services providers. What should MSSPs consider when proposing work for healthcare providers, and a few final words of wisdom there about how they should manage their risks, perhaps?
Well, the thing is determining what the actual risks that they're looking at within the organization first and foremost. And the thing is too, is a lot of these these managed service providers say, well, I've worked in healthcare. I understand healthcare. I understand all the compliancy items that come with healthcare. And sometimes, no, they don't. And that's basically a major problem that we at times face, because, these individuals, these vendors, in my opinion, they start bringing up this beautiful example, this project outline. I mean, it's kind of like a used car salesman, and that's what I call them. And then they really come out, they bring you, they're promising you everything in the world, but then they don't deliver on these specific initiatives. Bottom line is understand healthcare, understand the risks that are associated with healthcare, understand the complexities that cybersecurity brings into this environment. Because at the end of the day, this is what I always say, is that cybersecurity isn't just about data security, it's also a matter of life and death. Individuals, managed service providers need to understand our industry. And if we cannot have that peer-to-peer conversation, then basically you're just part of a vendor list from there.
Right, great, thanks, Mike. Howard, a few final words.
I loved it. That was great. That was a great conversation right there, Mike. Thank you. I agree completely. And we see it a lot. And from my vantage point, what you need to understand is that our patients and their families, they see us because they're having a very bad day. I mean, they're really having it's the last thing we need is something to happen to them while they're using our services. We don't want something to happen to their data because they're already having the worst day probably of their lives right at that point. So understanding, the what healthcare is, how important patient care is to us, how important data protection is to our patients and our associates. Those are the things that I think at times do lack. They understand, running a log to a SIM, for example, but really the underlying business of why we do what we do and how they can even move further in assisting in those areas is something that I would say.
Cool. Thanks for that, Howard. Fritz.
I would say, first of all, don't call me. I don't take sales calls. But second of all, I would say, stop upcharging us for things that we have to have because we're a highly regulated industry. SOC 2, high trust, HIPAA certified, which is no such thing, right? Stop charging us for those things we have to have, right? Because if you want to sell to healthcare sector, you need to build that particular infrastructure and then sell that to the customers and make sure you have what they need.
Right. Good points of advice. And Kevin, over to the used car salesman, right?
Amen. Yeah, I'm the guy that keeps the used car salesman honest. I'm the technical specialist, so I keep my client executives from spouting those lies. But what I was going to say is I totally agree with all the guys, and this is specifically why I moved to cybersecurity for healthcare, because it is about life and death. I mean, in our industry, the human is the first thing that we're going to protect, and in this industry, it's very literal. If they can't get access to Epic medical records, then someone may die. If there's an IoT device that gets DDoS, someone may die. So we're seriously dealing with someone's life in our hands. And to you guys' point, as the vendor, something came up actually within a conversation with one of my customers this week. They are dealing with endpoints that are FDA certified, and we don't, unfortunately. They need Windows 7 as the operating system, or one of the required operating systems, due to the compliance regulation. However, we don't support it anymore. And why is that? Because we're not having those conversations. Microsoft isn't speaking to the healthcare industry. The healthcare providers aren't speaking to us. So we need to start having those conversations so that we can know and frame up, a means to provide you with a strategy to get to where we need to go. Because I completely agree with you, Fritz. We have one of the most complex licensing models in the world. You probably know that. And, you know, when you're looking for something that you need, and they're like, hey, this is within this P2 license right here, you're probably just like, okay, well, we need this to solve a problem. So transparency, clear business use cases, communication, and remembering this is about the human at the end of the day, not about selling something.
Cool. And if anyone's in dire need, I've got my Windows NT 351 discs still sitting on the shelf here, just in case, right? So great. Thank you. Thank you very much. Thank you, everyone. It was a great conversation here today. And hopefully we were able to share some very pertinent ideas, thoughts, and opinions with the audience today. Thank you.
I love it. Well, thanks ever so much. Great panel as always. Great topic. I love this, and obviously a lovely Colorado crowd as well. So please give Richard, Howard, Michael, Randall, and Kevin a big virtual round of applause. And yeah, I look forward to continuing the conversation.
It's certainly a continuing one. Put it that way.
I'll see you in the audience, and I'll also see you, Richard, later for our concluding panel. And by the way, Kevin, you have fans in the audience. Not that everyone else doesn't have fans, but Kevin, you have fans in the audience. I'll see you soon, and please join Discord so you can continue the debate.